Hi, I'm Bob Ray Sanders here with Cynthia Allen, and we're taking sides this time on Ebola and the expansion of these quarantines that governors are now getting in the act on, returning healthcare workers from Liberia or any other African country in West Africa that may have had Ebola patients. You think that's a good idea?
Well, I think the states have the right to act. The governors have a right to determine what's best for their citizens, and it's a public policy issue, it's a public health issue. And so I think that what Governors Cuomo and Christie and Malloy and Quinn, three of whom are Democrats, I'll point out. So it's a bipartisan issue, and I think that they're within their rights to do what they would like to do. I am disappointed with how the incident in New Jersey was handled. I don't think that nurse was treated appropriately, and I assume that will not happen again. I know that she's been released.
Or she was quarantined in a tent, you mean?
Well, and it doesn't sound like the circumstances there sounded pretty outrageous. But the idea of a quarantine for healthcare workers who are more likely to actually get the illness than ordinary folks, I don't think that's an absurd thing.
Well, first of all, just because it's bipartisan doesn't mean it's non-political, and I think these were political acts per se. The governors, yeah, they have the right, but that doesn't mean they should do it. I mean, I think they should be listening more carefully to the healthcare professionals, to public officials who know what healthcare precautions ought to be taken, and they ought to listen to them, not go out there on a limb and do something to add to the panic nature.
I don't think they're going out there on a limb, and I don't think it's adding to panic, but there's some other issues here. The governors, they answer to their constituents, and their constituents are obviously really concerned, and they're obviously contacting them and expressing concern, and so this is a way of actually alleviating some of the panic because they're trying to control the circumstance. And secondly, the problem is that a lot of people are not confident in the CDC right now because we've had these changing protocols. We're learning things about Ebola that we didn't know a couple weeks ago.
Well, listen, we're a week away from an election, and frankly, everybody's trying to make Ebola part of the election process. The campaign, if you will. These governors are stepping out there because they think, yes, they're not answering to the people. They're not trying to protect the people. They're sensing the panic, and they're trying to say, hey, listen, I'm the one who can stop the panic. Well, they're not stopping the panic. They're adding to the panic.
I don't see how they're adding to the panic by trying to control and contain the issue. I feel like they're within their rights, and also they're trying to do their best on behalf of their constituents. We know
you give them a lot more credit than I give them.
Well, you're pretty cynical about that.
Yeah, I am cynical. I'm cynical about politicians who do political acts and use the public spheres to do that.
I disagree. I do think that there's a public policy issue here, and I think that the fact that we see it in so many different states with people with disparate political backgrounds are acting similarly indicates that there is really a policy issue here. Also, I think it's important to point out that the doctors at Emory have discovered that the virus can live on someone's skin after they start exhibiting symptoms. So that's something that we've learned recently, which is something that is of concern. And if we have folks who are out in public and who are starting to become symptomatic, and
well, we were talking about healthcare professionals here who do know the symptoms, who have been self-monitoring, which is what they were doing. I mean, they knew that if they were not symptomatic, they could not pass the disease on, and as soon as they became symptomatic, they put themselves into quarantine.
Right, but like this doctor in New York, which I think his behavior was probably a little irresponsible, even though he did contact authorities once he became symptomatic. He was out and about all day. You could be out and about, touching things. He was bowling, he was on the subway, and become symptomatic during the day. And once you become symptomatic, we know that illness can now be translated, and it's highly contagious once you're symptomatic. So that's an issue.
That is an issue, but he was not symptomatic while he was out.
But he could have been, and anyone else could be in that circumstance.
Yeah, but could have, would have, should have. He did.
Exactly. That's why we need quarantines.
And that's why we need to pause right now because our time is up.